This video is on Crohn's disease. So Crohn's disease is a type of inflammatory bowel disease which causes swelling and irritation of the tissues called in a process known as inflammation in the digestive tract. So this can lead to belly pain, severe diarrhea, fatigue, weight loss, and malnutrition. Inflammation caused by Crohn's disease can affect different areas of the digestive tract in different people. Crohn's most often affects the end of the small intestine and the beginning of the large intestine. The inflammation often spreads into the deeper layers of the bowel. Crohn's disease can be both painful and debilitating. Sometimes it can lead to serious or life-threatening complications. There is no known cure for Crohn's disease, but therapies can greatly reduce its symptoms and even bring about long-term remission and healing of inflammation. With treatment, many people with Crohn's disease can function well. Symptoms of Crohn's disease include diarrhea, fever, fatigue, belly pain, cramping, blood in the stool, mouth sores, reduced appetite and weight loss, pain or drainage near or around the anus due to an inflammation from a tunnel into the skin called a fistula. Crohn's disease can affect any part of the small or large intestine. It can involve multiple segments or maybe continuous, and most commonly involves the last part of the small intestine. And some people, the disease is only in the colon or the large intestine. So they can be mild to severe symptoms, but the symptoms do develop gradually, or sometimes can come on suddenly without warning. Someone with Crohn's disease may also have periods of times with no symptoms. This is known as remission. So the exact cause of Crohn's disease remains unknown. So previously it was diet and stress were suspected, but now these factors are known to aggravate but don't cause it. So several factors have been linked to play a role in its development. These include genes, which more than 200 have been associated with, but they're not sure what researchers aren't sure how these play in the condition. But if you have one or more of the genes, you're more likely to get Crohn's disease. Immune systems such as bacteria, viruses, or other environmental factors consider it. So bacteria in the gut microbiome are suspected to be associated with Crohn's disease, but it's unknown if these bacteria cause Crohn's disease. So when the immune system tries to fight off an invading microorganism or environmental triggers, an atypical immune response causes the immune system to attack the cell's digestive tract too. So risk factors can be family history, age. So it's more likely if you're younger, that's when you're more likely to get it, or it can happen at any age. People who have got Crohn's are diagnosed usually before 30 years old. Ethnicity. So white Europeans have the highest risk. And cigarette smoking is also a risk factor. And also non-steroidal anti-inflammatory medicines. So these include ibuprofen, naproxen, sodium diclofenac. So while they don't cause Crohn's disease, they can lead to inflammation of the bowel that makes Crohn's disease worse. So Crohn's disease can lead to one of the following complications. So bowel blockage or obstruction. So it can affect the entire thickness of the intestinal wall. So over time, parts of the bowel can scar and narrow, which can block the flow of digestive contents, known as a stricture. Surgery to widen the structure and remove the diseased portion of the bowel can be necessary. Ulcers, so ongoing inflammation can lead to open sores called ulcers in the digestive tract. These include the mouth, anus, and genital area. Fistulas, which can extend completely through the intestinal wall, create a connection between different body parts that shouldn't be there. Fistulas can develop between the intestine and the skin, or between the intestine and other organs. So these are more around the anal area, the most common kind. So if they develop inside the abdomen, it can lead to infections and collections of pus called abscesses. So this can be life-threatening if not treated. They can form between loops of bowel in the bladder or the vagina or through the skin, causing continuous drainage of bowel contents to the skin. Anal fissure, so this is a small tear in the tissue that lines the anus or the skin around the anus where infections can occur. It's associated with painful stool to lead to a fistula. Malnutrition, so diarrhea, belly pain, and cramping can make it difficult to eat or for the intestine to absorb enough nutrients. It's also common to develop anemia due to low iron or vitamin B12 caused by disease. Colon cancer. So Crohn's disease affects the colon and this increases your risk of colon cancer. So people who have got potentially Crohn's disease and at risk of colon cancer, a colonoscopy is required to screen for it. Skin disorders, so you can develop a skin condition called hidradenitis suppurativa. This involves deep nodules, tunnels and abscess in the armpits, growing under the breasts and the perianal genital area. So some Crohn's disease treatments can increase the risk of skin cancers, or so a routine examination is recommended. Also problems can occur with low iron. Anemia, basically, osteoporosis, arthritis, kidney stones, eye problems, gallbladder, liver disease. And certain Crohn's disease medications can block function of the immune system, and these include risk of developing cancers, such as lymphoma and skin cancers. Also, corticosteroids can be associated with risk of osteoporosis, bone fractures, glaucoma, diabetes, and high blood pressure. And blood clots, so Crohn's disease can increase the risk of blood clots in the veins and arteries. So for diagnosis, blood tests to check for anemia. Also check for level of inflammation, liver function, and presence of inactive infections such as tuberculosis. Blood can also be screened for presence of immunity against infections. Stool studies to check for blood organisms such as infection-causing bacteria or parasites. Sometimes looking for stool markers of inflammation such as calprotectin is useful. A colonoscopy, using a tiny camera on the end of the flexible tube to visually examine the entire colon and the very end of the ileum. So small samples of tissue called a biopsy can be taken for laboratory analysis. This can help make a diagnosis. So clusters of inflammatory cells known as granulomas can suggest a diagnosis of Crohn's disease. A CT scan, which looks at the entire bowel as well as tissues outside the bowel. An MRI scan, which uses contrast fluid to create detailed images of organs and tissues. A capsule endoscopy, so this involves swallowing a capsule with a camera in it. Camera takes pictures of the small intestine and sends them to a recorder worn on a belt. The images are then downloaded to a computer displayed on a monitor and checked for Crohn's disease. The camera exits the body painlessly in the stool. So there is no treatment for Crohn's disease currently. There's no cure currently for Crohn's disease, but there's no single treatment that works for everyone. So there are several medications. So you have anti-inflammatory medications such as corticosteroids, and they don't. So these can be used for short-term remissions and improving symptoms. Oral 5-amino acylates. So these include sulfalazine, but they don't work as well if the disease in the small intestine. Immune system suppressors. So these reduce inflammation but target your immune system, which produces a substance that causes inflammation. So you can have azathioprine, mercaptopurine. These are most widely used immunosuppressants for treatment of inflammatory bowel disease. So you have methotrexate. So this is sometimes used for people with Crohn's disease who don't respond well to other medicines, but you do need to be monitored closely for side effects. Biologics such as infliximab, adalimumab, and setrusumab. So these are TNF inhibitors, tumor necrosis factor inhibitors, and these work by neutralizing tumor necrosis factor. You can have ustekinumab, which treats Crohn's disease by interfering with the action of interleukins, which is a protein involved in inflammation. Vedolizumab, which is a type of monoclonal antibody. It binds to integrins, stopping it binding other cells in the cell lining, so it's a gut-specific agent. You also have risankizumab, which is a monoclonal antibody, so it works against interleukin 23. You have synthetic versions of biologics called biosimilars. These work like the original versions of biologics. You have JAK inhibitors, so Janus kinase inhibitors. These are small molecules which induce inflammation by targeting parts of the immune system. They are taken orally. Then you have antibiotics, which can reduce the amount of drainage from fistulas and abscesses and sometimes heal them in people with Crohn's disease. So these include ciprofloxacin and metronidazole. So as well as controlling inflammation, some medicines can help relieve symptoms. So you can also have antidiarrheals, such as loperamide, which is for severe diarrhea, pain relievers, such as acetaminophen. But you don't want to be taking naproxen or ibuprofen, which can make symptoms worse. And there's vitamins as well, vitamin supplements. That's the end of today's video. So quite a long video there on Crohn's disease. But I hope you've learned something new. And thank you for taking time to watch. Please remember to like, share, and subscribe, and tune in for the next one. Thank you. Bye bye.